Just to say that Mentimeter is great because it allows us all to contribute, even if you're not a person that's comfortable talking in the group. But at the same time, we really want to record the dialogue and learn more from you about what your thoughts are on this. And I'll just say, in terms of who benefits, I think there are corporate interests who are, and political interests that are utilizing disinformation in particular and fake news to position themselves with an electorate or a public or consumer. Thanks.
Thanks, Shannon. I think that's certainly a lot of the information that Simon shared. And I think there's, agreement amongst a growing number of individuals who are concerned about that. Any other thoughts from the group, or Serena, if we're having some submission to the Mentimeter or some impact there? Happy to hear people's perspective.
So we can probably, we could go to the second question if people don't have any more to add to that first one.
Agreed. So perhaps this is closer to people in terms of how has this personally impacted you, or has there been an example of misinformation or even disinformation that's personally impacted you? And would be happy to hear that. And also shared on the Mentimeter as well. I know there's people in the room. I'm not hearing from anyone.
Excuse me, how do we see the results on the Mentimeter?
They're going to be provided kind of when we move back together into the larger group. Is that Debbie? Yeah. Debbie Sullivan? Yeah.
Yes.
I wonder if what is the, can someone just tell me the code for the Menti, and I'll try. I don't know. I don't think I can show the results.
Yeah, Christina will share everything. So I think it's going to be easier for you just to get through the questions and for us to record. But maybe the trick here is for us to just go through person by person in the room and just ask for their thoughts in general.
And Jeffrey Connor shared in the chat that he, from the last question, that he thought large organizations and corporations are the ones benefiting from the resulting chaos.
Yeah. Thanks, Serena, and thanks, Jeffrey, for offering that.
I can share a story.
Yeah, personal experience.
Personal experience is when my profession is a dietitian, and I wrote an opinion piece once, which wasn't fake news, but it was reporting on something, a court case involving Monsanto with their Roundup. So they, some farmers, there was a class lawsuit against them for the product, one of their products contributing to getting cancer. And then the court this happened in the States, and they found Monsanto guilty of not having the proper safety instructions on the, anyway, so I reported on this, and a bunch of, I guess, pro Monsanto people, I was like inundated with like hate mail telling me that I was stupid and that, you know, this product was safe and it's been proven safe 1,000 times. And someone actually reported me to my professional college as being, you know, as saying things that weren't true, and everything that I said was true, and so I ended up having to hire a lawyer, and I won, and I cleared my name. But it was really shocking to me that there's actually people who, I guess, they just like troll the internet for keywords, and then if you said anything on this product, that they just start like sending you hate mail.
Bombarding you.
Yeah. So it was really scary for me and eye-opening, because I actually wrote this opinion piece was in like my local newspaper, and I live in Salmon Arm, so it's like readership of like 100 people. But I think because it's available online, you know, people who are you know, searching that, you know, it comes up, and yeah, so I learned my lesson. I don't want to be vocal about, you know, you have to be careful when you're saying your opinion online.
Yeah. Well, it's an unfortunate lesson to learn. Sorry, Jeff, please go ahead.
Oh, I was going to say, just going to follow up, Serena. Thanks. Just down the road in the Cradle-Sequamic territory in Kamloops. And I know one of our colleagues did a piece around vaping and just questioning the evidence on that. It was a couple of years ago, which we're still kind of sketchy on the evidence around. And the piece brought a vaping company executive directly contacted her as a result of that and the trolls that came with it. And so it can be quite challenging, and particularly from a late, you know, again, thinking about having to fork out dough for a lawyer just to suggest that the evidence is there is a bit disconcerting for professional practice.
Yeah, like it really, well, and it really made me think how disempowered, you know, health professionals are. Because I was lucky that I was in a situation where I could hire a lawyer. I think a lot of people, so they wanted me to rewrite the article. And I think a lot of people just would have done that. And just because I've got lawyers in my family, like my dad's a lawyer, my sister's a lawyer, and they're like, this is BS. You should fight this. So I was in a really privileged position to be able to do that. I think most people in my situation would have just rewritten the article because that's the easier route, right?
Mm-hmm.
So.
Well, it brings up a really important point, and Emma, I see you in the text, and Chelsea as well. It brings up a really important point of silencing diverse voices, and that's a real concern, especially if we're researching these areas and coming up with apparent evidence that your voice is being silenced in a very effective way. And you're talking about being careful about how you're going to participate. And I think that's really challenging and really difficult, and something that we need to be paying attention to as, again, part of this ripple effect. I'm just going to read what, sorry, go ahead, Debbie.
I just wanted to say, and mine is not about publishing an article or that, but I am a public health nurse, and my daughter is a public health nurse, and a family member who, we're on the internet, I better not say who it is anyway, a family member told me at Easter that COVID was a communist conspiracy, and that they are not going to get that killer vaccine. And I'm like, how do I respond to that as a public health professional who's supposed to be saying the right stuff?
Yeah.
And, you know, like it goes from the highest levels to the lowest levels, just a person who reads crap on the internet.
Yeah.
And, you know, that person is part of like what was talked about, the network of people in the echo chamber that have those beliefs about that. And it is very hard as an individual to respond to that, because it just causes a fight. It doesn't, like a lawyer is not going to help this situation. An expert is not going to help this situation. It's just, well, I don't know how to manage it, but I think it exists not just in my world, but all over the place.
I would agree. And if I can offer any support, I know that some of the research literature is suggesting that in fact, the rebuttal online as quickly and as swiftly as possible with some of these messages has been proven effective, or at least had an impact. But I don't think there is one single answer. I think it's really looking at, again, that ecosystem. And it's almost who has the loudest voice online, or through social media. And it's been through social media that a lot of this misinformation and in fact disinformation is being shared. And so to kind of tackle that on a personal level, I can only imagine, Debbie, is a really challenging experience, and especially with family, right? Especially with family. So again, it's just the rebuttal, offering up facts. Have success. It's tough. There's no question.
And Emma's in the chat. She's saying that through her research experience that she's seen a lot of supplement companies or alternative health corporations sharing health misinformation in order to gain profit. This goes along with influencers on social media who have the opportunity to benefit financially from sharing health misinformation and referring viewers to certain products. This is dangerous because some of the people referring others to supplements are often medical professionals, and both them and the company benefit from installing fear and spreading misinformation about unproven health benefits.
Yeah, thank you for that. And Serena, I'm just wanting us to be mindful of time. I just saw the message from Christina that we have 15 minutes left, but I do want to address that, as it's particularly challenging if there's so much conflicting information. And that's what we were hearing from people that we were speaking to and conducting research with. That was the most challenging thing. And so people at some point, especially those with limited access or limited resources with respect to certain types of information, kind of just throw up their hands and just say, you know, who do I believe, and then how do I act? And then it's to those trusted individuals, which why some of the strategies to combat misinformation really were linking communities with people that they trusted and making sure that those individuals had the accurate information, had the facts, had the evidence as much as possible. So again, I don't think there's really an easy answer to that, but Emma, thank you for your comment, and Serena for bringing that to our attention.
Yeah, and I just want to add one more thing, like in retrospect on my article, because obviously I thought about it afterwards. I think it's challenging because so the people who took them to court were people who were actually spraying the product, right? And so to say that someone spraying the product has the same risk as someone consuming that product at the end of the, you know, the residues of that product on food, you know, those are two different things. Mm-hmm. And so I think when you're addressing sort of gray areas that are not well known, I think because you are in a position of power, like I can understand on one level where there is, for example, with supplements, I mean, that's a really strong issue with dietitians. Like, we do not recommend supplements because of this, right? It's like we're in a position of power. And if I tell someone, you know, that they could try this alternative medicine, we're a bit afraid because of that. But then what happens is that we don't discuss alternative medicine in our profession, which is also not necessarily healthy either.
Exactly. It really puts you in a bit of a bind. And we're seeing not the same, but similar consequences with some of the online vaccine information and the anti-vaxxers. And some of the work that we did with respect to social media and decision-making really highlighted the way that information is even being structured. So such that the information is looking very scientific, it's looking very sophisticated, it looks very much like what you would see perhaps from a health unit. And so just the appearance or the aesthetics of information that's being offered is important in how it gets displayed online and then taken up as legit or credible information. So again, I go back to, you know, just this real sophistication around being able to discern information, good from bad, credible from not, understanding the science. It's a big ask of people, but I think we need to do that. We're in that space now, and we need to do that. Serena, I know we have a third question. Is that something that we can have a look at? I can't remember it for the life of me right now.
Yes.
Let me see if I have it on another document.
What did I?
It should show up
Oh,
on
here we
people's
go.
Mentimeter, yeah.
How does this apply to public health practices? And that would be the final question. If there can be some response within the chat, response within kind of verbally, and then some ideas around how this applies to public practice. Or does it? Maybe that's where we should start. Should we be accountable to this as a public health entity? Marie, I see your comment too around addressing misinformation as part of health professional education programs. I cannot agree more. Yeah, I think it needs to be in there for sure. Any thoughts around, what do we do from a public health perspective or public health lens? Is this something we need to touch? Or is it only around, I guess there's the issue of foundational. Do we need to be paying attention to health literacy and digital health literacy? Is that something that we need to be tackling as a public health entity? Is that a public health issue? Or is it that we just need to tackle it as a consequence or in relationship to a particular issue? For example, vaccine or kind of that range of anti-vaccination or vaccine to vaccine confident and willing.
I'll chime in again.
Yeah, Jeffrey,
where's Amelia? I see her there anyway, some other folks, but nonetheless, I think particularly right now we have an opportunity given the public health crisis that's happened, and we haven't talked about the one that's killing more people in opiates, but around providing adequate communications and really robust and timely and open to the public as much as possible to build some of that confidence. I know in BC, we've had some struggles, and elsewhere has walking through this coronavirus thing. It's novel, and it's, some people don't understand that when you don't understand something, it takes a while to understand it. But nonetheless, with the things we do, I think we need to be as open about where things are working, where it's not, what's happening, to build confidence. And it has to, because otherwise the, conspiracy people and other folks will think government's hiding stuff, which we have in the past, and there's no doubt. But to get over that, I think we need a really robust communication system. If the stock market can report every day, maybe we should be reporting more too on indicators and things.
Yeah.
Yeah,
I heard trust in there too, Jeff. And Randy, I see you. Happy to hear from you. I can't hear you though. You're very quiet right now.
I think you're muted.
There. Oh, that was you, Serena. Randy, we don't want to miss out. I wonder how we can make this work. Can we give you a minute? Amelia, did you want to say something? And Randy, can we give you just a second to figure out the audio piece? Because we do want to hear from you. Yeah, thanks.
I think it's really, really important that we do, as public health agencies, speak out constantly, because the misinformation is just constant. It's constant, and they never stop. And so, they're always, they've got their machine going, and we keep thinking that, oh, well, we've given this information, so we're good to go. No, because we need to be dispelling all these fake news stories on a regular basis. And if we don't, what happens is it really grows exponentially. So yeah, I think we're doing a poor job in terms of communicating, because what ends up happening is every time we don't speak up, it gives them more fuel.
It sounds like you're agreeing with Jeff a little bit that we need to be the frequency of communication and perhaps how we're communicating. And I heard that from some of the third sector organizations. It can't just be the science and the facts. It has to be more than that. And so, yeah, thank you so much. Randy?
Never do personal stories, and we should be doing personal stories, because that's what the fake news people do all the time.
Yeah. we can learn from them, it sounds like. Yeah, and maybe we need to figure out who they are too. Marie, I see you. I just want to check in with Randy to make sure that we've given you an opportunity. No, Randy.
And you could type in the chat too. And we
Okay.
can read it.
Marie, did you want to comment or share some information?
Things related to the whole COVID issue. I think one thing, public health needs to go to where people are getting this false information. So maybe we need to have more public health on YouTube. Whenever there's an article in the paper, you look at the comments or any news stories, and it'll be 80% misinformation folks. I think they must spend their day, they're so passionate, just sitting and responding to news stories with more misinformation. And so maybe we need to actually have public health into form. We need to still use the media that we're using, but we maybe need to go directly to where some of this is occurring and address it there, and make sure that we have consistent messaging. I think the whole vaccine thing, where it seemed like we had different experts giving different opinions. So if we could, as public health, speak more with one voice. You know, we were pretty good to say, take the first vaccine available. Like a catchphrase like that really caught on. So I think we could be a little smarter, and we're going to have to be in public health in how we communicate.
Okay, thank you for that. And I agree. I think it's really important. Did someone want to add to that? Randy, you're going to give it a shot again?
Yeah, can you hear me?
Oh, success, you did it.
Yay.
Right.
Oh, Zoom and me are not friends. Anyways, I won't take time from our chat to gripe about technology. I am rewinding. I missed what was said, so I'm rewinding a few moments ago, but I wanted to comment on, I think, what Jeff was saying around trust. And so it was muffled for me just because of my issues, but I was typing away and I thought it would be good to share that my husband's Indigenous, and right now, and I feel vibrating because of the news that's coming out as well from Saskatchewan, but with these unmarked graves that we're discovering and going to continue to be seeing, and the heat, there's heat, so much heat as a mother, as a wife to an Indigenous person, living as an uninvited guest on Indigenous land, being a public health professional. I'm feeling like a lot of struggle right now. And my husband and his family really are struggling to trust in the voices that are leading this pandemic. And so it's taken time to really encourage him and empower him to register for his vaccine. And this morning I was able to finally not convince him, but just like get him to a place of understanding his role and responsibility. But his headspace has truly been this trust in this body that really historically has not had our best interests in mind. It's had a select few of the best interest of a few in mind. And so as an Indigenous person, he is really feeling that deep, deep distrust. And so I think it's not so much about that he wants to spread misinformation, because I can hear him feeding the conspiracy pieces, but I'm stuck in the middle of being a devout public health professional, but also wanting to hear and meet him where he's at. So I don't know if this is helpful in any way, but I just echo so much what was said earlier as a public health nurse, wanting to, be there for our family, but also just feeling like the personal and professional responsibility to share correct information, and then this blanket of grief that we are in with this devastating information. It's just such a weird time, such an incredible time to be a citizen and to be part of these conversations, but it's just incredibly heavy. And I don't know that many of us have the tools at our fingertips just yet to be able to feel comfortable to enter these dialogues. That's a heavy one for 2 minutes left.
Yeah. Oh, thank you for noting that. But I do appreciate that. And I don't know that we need to shy away from what's heavy. I think we need to be able to acknowledge all of the things that are impacting our understanding. And that's certainly an important kind of that legacy relationship that's really impacting people's understanding of information and really shaping where they're willing to take information from. And so I talk about earlier how our health literacy, digital health literacy skills really shape where we access information and where we will accept it from. So I really appreciate that, and value you sharing your challenges as a professional and then personal. And that makes it sometimes difficult too, but makes you a better healthcare provider, I think. Yeah, thanks for that, Randy. Any final thoughts from people before we move in? Hopefully people have had a chance to comment as well on the Mentimeter and add your thoughts there. But I think that we're just gaining momentum in this conversation. There's lots more to talk about. And I think more than that, I think there are opportunities within public health. And I wonder if there's even a more activist role that public health could play in terms of combating misinformation and really supporting the going to kicked out of this room in 50 seconds now. So a final word from anyone at all?
I think there's a whole nother topic about distortion and how public health messages can embed distortions around norms that are considered acceptable by social systems and social structures that are inherently flawed. And so I think we have to be mindful not only in our responsibilities to communicate, but to manage distortions that present norms around you, thou shalt and you should, and the coercive nature of public health has to be openly, as you said, acknowledged, and the deep work needs to be done. And I also want to acknowledge Serena's, there is a lot of assaults that happen in cyberspace.